Hello, Eva. This is Dr. Gay. I want to say what a pleasure it was to meet you today, and I want to thank you so much for coming into First Psych MRI. So I'm going to go ahead and start with your spine here, and then we'll go on to your shoulders eventually. But we did a view of your whole spine, actually several views from different angles of your whole spine. This is one that just shows everything on this one view. This is your head up here. You can see your brain stem coming down here through your spinal canal. And this is your cervical spine, thoracic spine, and then down here is your lumbar spine, and down really low is your sacrum. So as we zoom up on this, we can show you what is going on in your neck. So this is a view of your neck, and up here you can see your cervical spine. This is the top, right here, this little dot is the top one. This is number 2, this tall one, and 3, 4, 5, 6, 7. This is the lowest cervical. So if we look in here, we can see that you have some disc abnormalities at each one of these levels. It's between 3, 4, 4, 5, 5, 6, and 6, 7. Different disc protrusions, and you can see a couple of these push on the cord here. And now here we go again, between C6 and C7 is the most prominent. This little protrusion contacts the cord. You can see the spinal cord is right here, this dark band, and normally the cord should have fluid in front of it, which is white. So down here is normal. Look at the fluid in front, but you get here, where's the fluid? So between this level, this level, this level, and this level, these levels, there's no fluid in front or back. So you have what they call a central spinal canal stenosis. You can see these things touch the spinal cord at each one of these levels. So any one of these could be causing pain and irritating the spinal cord. But down here between this level and this level, so 5, 6, and 6, 7, if we go off to the sides, the edges, we see that the neural foramina, where the nerves come off on the edges, they're narrow. So this is a normal foramen, this hole here, a keyhole, and up here you can't see the keyhole because the nerve is getting compressed by a little disc and spur. Same thing here, and to a lesser extent at these levels. So several levels, actually up here too, between 3 and 4, you have this disc bulge or protrusion and some spurring from the facets, some mild arthritis of the facets, and this also causes some narrowing where the nerves are trying to exit. So several things here in the neck that could be causing symptoms. Luckily there's no big huge disc herniation, but again this thing especially does touch the cord and can irritate it. And again, the nerves are getting pinched at several levels, could cause neck pain. Now you have another disc abnormality here in the upper thoracic spine. This is right here between T3 and T4. You have this disc protrusion right here, and you can see it touches the spinal cord. You also have a little bit of slippage between T3 and T4. See how this is slipped to the left a little bit, and the disc is narrowed? And so that touches the cord, but it doesn't cause narrowing of the canal. See how there's fluid behind it? There's plenty of room to breathe, but this definitely could be causing some symptoms. Now if we go down further in the thoracic spine, there's another disc protrusion, another little, they call it a herniation or protrusion, and this is towards the right paracentral, and this touches the spinal cord again. This is between T8 and T9, and again there's not significant central canal narrowing, but you can see it does touch the cord, and again if you move around and twist, it could irritate the cord a little bit. And so the last thing is down the lumbar spine. I think this is the thing that's just as worrisome as the cervical spine. You have a couple of disc abnormalities down low. The worst one here is between L4 and L5. So if we move you down here, this is L5, L4, L3. And up here, these other ones are just stone cold normal. It's like a perfect disc. Everything looks great. Here's fluid in the spinal canal. You can see all these little things like spaghetti of the nerves. But if we get to this level between L4 and L5, look at that broad disc protrusion or bulge, and that goes off towards the left side here, and it's elevating a nerve slightly. And there's another nerve that comes down here, it's pushing on. And if we go off towards the right side, it protrudes into the right foramen. And so the nerve is trying to come out, but you can see the nerve is elevated there. So you have a moderate right foraminal stenosis because the disc herniation or protruding disc is elevating the nerve on the right, and on the left-hand side you have a mild foraminal narrowing and elevation, and also there's a nerve down here that goes down to the left leg. It's getting pinched right in this area. So significant findings at each level, and hopefully you have your doctor you can talk to, and they can give you advice as to what they would recommend for treatment. Anyway, thank you so much again. I hope you have a great weekend.